form of a tincture is my decision. Okay? Nobody should regulate how much I use, how, like the pharmaceutical, when they would say to me after my full knee replacement, here's some Vicodin. I want you to take this 3 times a day. My pain level was on a scale of 1 to 10. It was 20. I didn't want to take that. I threw it. I dumped it down. No, actually, I disposed of it safely. Okay? So, I guess what I'm saying is, I'm a mover and a shaker. If you all want to coordinate, if you want some synergy, if you want to expedite things, here I am. Thank you very much.
Thank you, Rick. Are there any questions? Thank you. Still taking testimony in opposition. Mr. Albert.
Good afternoon, Representative Katine.
Good afternoon.
Ricky, members of the committee. You all have received my written testimony in opposition. I'm still opposed, but for different reasons now after the amendment. So I'm happy to have available for you at the work session the system architects for the portal that you've been hearing about. There is no data. PHI is being transmitted over the internet. There is no data. Hear that, okay? This is a PDF screen. As soon as the physician or the nurse practitioner hits print, the data disappears, except for the date of birth if you're a minor, and except for the zip code. That is batch filed, and that is given to the department in the form of a report. I'm happy to have them come and present to you at the work session so that you can be more comfortable with that. Quite frankly, I think the portal is safer than, we've talked about data breaches, and we've talked about the ability for hospitals to be able to dialogue openly about the use of medical marijuana. Yet on this topic, we want to hide it again. Most physicians now are using an electronic medical record that has all the patient name and date of birth and diagnosis and certification process that we're concerned about the state having. I don't want, the Department of Health and Human Services does not want patient data. You read my letter this morning about the issue of debilitating medical conditions. The department wants to be out of the middle of the physician and patient relationship once and for all. So we don't want this data. There is no name and address and date of birth that is transmitted over the internet. There is no statewide patient registry. Providers do not have to submit anything to the department, and we don't want to set up a system where it becomes administratively burdensome for a healthcare provider to submit us reports, a caregiver to submit us reports. It's not necessary. We get the data that we need now, a zip code, so that we can manage the medical marijuana program in this state. As an example, we only had 1,200 patients roughly that were registered voluntarily because of the card. Just from January 5th to March of 15th, we had 9,773 patients get certified by over 240 medical providers in the state. It was thought before then that we only had about 12 to 15 providers who would be willing to certify, which gets at the capacity issue that Andy raised this morning. The feedback that we're getting regarding this portal from law enforcement is outstanding. What happens is data gets entered into a top part of a form. Again, it's PDF. The fields disappear when the provider hits print. The reason for that, though, is that it self-populates a certification card on the bottom of the form and a designation card on the bottom of the form. So the patient gets, at the point of care, which they never used to get before, they get a card that is laminated like your insurance cards, as an example, that they can carry with them immediately right at the point of care. Feedback from patients has been outstanding on that issue. The designation card also, it puts a numerical indicator on the certification card and on the card that is used for dispensary designation and caregiver designation that is a common number between those two cards, and that is in an effort to prevent fraud. And I assure you, if you want to have a meeting with some dispensaries and some caregivers who will talk to you about the amount of fraud that was going on, this has helped that. But to think that it's not going on is erroneous. So it's been a successful effort thus far, and I'm happy to have answer more of your questions at the work session.
Thank you very much, Mr. Albert. Any questions from the department? Representative Sanders.
Thank you. The 9,000 patients, Mr. Albert, are those all individual patients, or would those be someone who may have had to visit the physician on more than one occasion?
There is a potential for there to be dupes, duplicates in there, but even if it's say 2%, you know, it's so roughly give or take 9,700 patients who are registered, which is significantly larger than what we had before, as far as being able to appreciate and also geographically where those patients are, which may help the department in the future, which may help the legislature in the future decide about where to either cap the amount of caregivers that we have in the state based on geographic location, or expand the amount of dispensaries in the state based on need.
Or expand caregivers and cap dispensaries?
I'm talking about the construct of the current law that we have in place today. That's all.
And how many physicians did you say?
242.
Oh, 242. Okay. Thank you.
Well, so again, I'm going to remind people, please, no outbursts, all right? I think we talked about it at one point earlier this morning. I don't know if everybody was in the room, but we really try to keep a lid on that, either for or against. But every point of view needs to be heard today. Thank you, Mr. Albert.
Thank you.
So I think we're taking testimony in opposition. Hello again.
Hello. Less nervous this time. This is round 2. I'll introduce myself again. I'm Darryl Goodrow. I'm a board member of Medical Marijuana Caregivers of Maine. Only a little less nervous.
I did fine in the morning, so I'm sure you'll be fine in the afternoon. Thank you.
Just wanted to, we had originally drafted up something we wanted to say here, but I think it's all been covered. I did just want to speak to a couple of things about the data or possible data breaching. While I agree with a lot of what was just stated about how the data is collected or not collected, I'll also say that there isn't, I own a technology company, and so I have a lot to do with understanding these things. And the reality is there's no protection at the computer that's actually doing the keywording and the typing. Yes, while I agree that the database is protected and it's a portal that they're only typing words into what eventually is a PDF, what they aren't protected against is any kind of keyloggers. I happen to know I know a few of the doctor's offices. I know how their computers are maintained, and I have zero comfort level in that portion of the data being collected. I'll further say that in my own community, the Lincoln County Sheriff's Department had their own data breach. You guys probably read and heard a little about that. The first thing they did was they came out and they reported in the newspaper that when you had that kind of a data breach, the best thing you could do is pay the ransom and pay it quickly, because they waited a few more days than they should have and they didn't understand what to do, and they jumped on board with paying the ransom and then telling everybody else to do that. If we can't trust that the Sheriff's Department and the local police departments have their computers protected in a manner where they won't have their data either breached or stolen or just crypto locked, then how can we trust that the doctor's offices that are new and upcoming and haven't spent the money on their information security, how can we trust that as those words are being typed in, my name, the town that I live in, and the phone number, that that's not being collected in the computer that did the typing, not at the server end where it was being sent? And so for that one reason alone, I have a lot of issue with this data being transmitted across the internet, even though it's being claimed as not. That's all I have on that.
Thank you very much. Any questions? Thank you, sir. We'll take testimony in opposition.
I am back. And may I speak in neutrality?
No.
No.
I mean, you already spoke, and
Okay. This would be pertaining to the previous issue in terms of safety, in terms of the card, but also in terms of this.
Yeah, we'll take written remarks, but you've already testified with respect to these 2 bills.
Understood.
Okay, thank you very much. still taking testimony in opposition? Taking testimony neither for nor against either of those two bills. Mr. Carrier?
Good afternoon. My name is Paul T. McCarrier, and I am from the town of Knox, representing Legalize Maine. I'm here to speak on LD 560. We support a lot of concepts of this bill. We want to make sure that patient privacy is protected. I think everyone covered a lot of those sections about for that better than me. And so I just kind of want to talk about the idea of what is real privacy. As I'm sure all of us know from working in this building, spending a lot of time in this building, is everybody talks. Everybody talks. You know, there's as soon as, you know, no secret will last as soon as one other person knows. And so when we're talking about someone being a medical marijuana patient, if you're a state employee, if you're an elected representative, if you're someone who works in this building, if you're law enforcement, it's extremely important that that information, it's medical information, is not revealed. It's just like if I was on a antidepressant and I was working at some point in state government, that information should be protected at all costs. So as all of you know, the state of Maine has been having a lot of issues lately with data security, and so even if there is even a little risk for any sort of patient information to be saved, as mentioned from the keystroke, or being mentioned from the fact that, you know, I guess we're going back and forth whether the data is being saved or not. I believe that this committee and this legislature should do everything they can to protect that patient's privacy, especially because marijuana is still a federally illegal drug. And so if you are someone who works in state government, who has aspirations to work in federal government, or if you are looking to move forward your career and you think that any sort of marijuana, medical marijuana note could be used against you, that's something that could be very detrimental, and we strongly support patient privacy and that everything should be done to ensure that none of this patient data is actually put onto the internet. Thank you, and I'd be happy to answer any questions.
Thank you very much, Paul. Any questions? Thank you very much. Taking the testimony neither for nor against. Okay. Any additional information that the committee would like before the public hearing? Okay, I'm going to close the public hearing on LD. Oh, sorry, Fran. I didn't see that.
I wonder if we might ask for sample of what these cards look like in the application. Just, you know, a blank one or something, so that we have an idea of what you're actually seeing and entering and all of those things.
You got to hit your button so I can talk. Fran, okay. You got to hit your.
Yes, I know.
Thank you very much. And again, I'd like to hear from, I know Mr. Albert said that he could bring somebody who designed the application of the portal. I think that might be able to have somebody like that available for us in the work session. Anything else? Okay, I'm going to close the public hearing on LD 21 and LD 560. We are now going to do public hearing on 5 bills and combine them together. LD 5, LD 266, LD 726, LD 766, and LD 1258. And I think, other than our own Representative Sanderson, I think we're still waiting for sponsors. So, let me take a 5-minute recess. See if we get some more sponsors here before we start. Thank you.